Hi, Michael. I have a couple more questions to ask you today about norm therapy. So the first one is, what is norm therapy?
Norm therapy is my interpretation of many years of understanding that after all the countries and all the cultures that I have endeavored to learn and understand and visit, that people are pretty much the same. That is my final conclusion. I know this has been said in many educational settings and many, especially military and occupational workplaces, where people end up seeing that people are pretty much the same. They're dealing with the office in Italy. That office in Italy is doing the same thing as the office in Austria, the same as the office in the United States. They're just doing it in a different language, and they're achieving the same results if you put it in that comparative understanding. Norm therapy is a bit different and a little bit more complicated than that, because whether we establish a rule for business in America, that may be the same rule we're trying to adhere to in Italy or Austria, but it may not conform because of the laws, because of the culture, because of the people, because of they take 2-hour lunches in Europe. And they take 40 minutes in the US and they're running back with food and their napkins still in their collar. All different cultures would bring back different or returns different kinds of results. Norm therapy is different because it makes an attempt not to give you the normal of the circumstance, the normal of Italy, Austria, the United States. It looks at your normal and how you fit in that normal. Basically, when a person has been abused so often, or even acutely on such a profound level, when they've been abused in this manner, be it financial, psychological, sexual, child molestation, bullying, whatever kind of abuse, if it's happening over time, they're going to try to become okay with it because they're enduring it. And they have to figure out a way to survive it. And one of the things they do is, and one of their coping mechanisms is to normalize it, to make it okay to get slapped every day and say, he loves me or she loves me, or take all my money and leave me broke. And because they love me and they're trying to take care of me, they do this to me. Or some child trying to reconcile why a grown man or woman is doing those things that they don't even understand that sensation as a result. You normalize those kinds of things and you become conditioned, because I've always said to people, and the reason why norm therapy is norm therapy, and we'll talk a little bit more about defining that as I continue this conversation, is because once a person experiences abuse, they have a choice to make. And that choice is, do I take this or do I not? So norm therapy is, in my design of traveling the world and having given much advice over the years, is my way of saying, let's find your normal. Not mine. I don't want to give you my normal, because my normal, I can rucksack 10 miles into a jungle and shoot, move, and communicate with ease. Even as my old age, I can do that. You can't. So I'm not going to give you my normal. But can you walk 2 blocks without huffing and puffing and maybe cross your legs over there in the park and relax? That could be your normal, especially with the view. So we cannot lie to ourselves. This is the problem. Humans are incapable of lying to themselves. No, animals are incapable of lying to themselves, but most especially humans. Because if I look at you now and I say, Kim, your nose is green. You know your nose isn't green. I know it isn't green. It's incapable. You have no capability of believing that on any level ever. We're incapable of that. However, if I walk in every day and I take my hand, put it on your shoulder, and I squeeze my fingers until it hurts, you're afraid of me now. I intimidate you. I'm hurting you. But I tell you, your nose is getting a little bit, I think it's a little lighter green today. And then tomorrow I do the same thing with my hand and the shoulder. And I tell you, well, no, it's dark green today. What's going on with you? 6 months from now, you're going to look at your nose in the mirror and go, it is a tinge little green there. It is a tinge of green. Because you've not lied to yourself. You just conditioned yourself to deal with that lie. Condition yourself to deal with that pain. conditioned yourself to deal with that person who intimidates and hurts you and takes you off balance. So what do we do with norm therapy? We go in and we try to extricate and pull out those lies, uncover them, and help you find what your reality coulda, woulda, shoulda been. And we try to reinforce that growth forward instead of from where you are, damaged and hurt.
Great insight on what is norm therapy. Thank you. So we hear about the 3 tenets: clarity, assessment, and truth. Can you explain more about getting to the truth one person at a time?
Absolutely. And I'm glad you put it that way, because I've always wanted to hear it that way coming to me. Clarity, assessment, and truth. We call it our CAT. Well, I like to call it. No one is calling it that at Arrow right now. I'm gonna see if I can get it to catch on. But the clarity part is, how can you do anything in life? Whether you're gonna make a recipe for some tiramisu, or whether you're gonna go to school tomorrow and take a test in class, or even you're gonna speak to your parents tonight over the phone about a pending operation or some type of calamity. How do you get to the point where you're all understood? It's through clarity. Clear away the clutter. Clear away all of the hyperbole, all of the, well, I'm not going to tell them that because I don't want them to know that I'm dying or I'm really sick. Clear all that away. Find clarity in that. Find clarity in that school assignment and those expectations and expectations from the school, your classmates, your professors. Get clear and emphatic on that which needs to be done. Norm therapy tenet number 1 is clarity. If we are hearing lies or prevarications and hyperbole as a result of dealing with an interviewee, a survivor, or a victim, we oftentimes, because we're trained on lie detection, we oftentimes are observing our patients, for the lack of a better term, because they're really not our patients, they're our interviewees. But in that context, I want you to see, we're advising ourselves to pay attention to their baseline, to their normal. They normally fidget when they talk. They normally open their eyes when they're about to answer a question. They normally smile when you put them on the spot. If that's something normal to them and you think that they're providing truth, then you make notes. You, as a norm therapist, you take notes and you make notes. So when they do lie, and we teach this as well in much more detail, but when they do lie, but every time they lie, they put their hands over their mouth and they start talking like this. But they don't know it. It's an axiomatic and involuntary response to lying. Or you look at their arteries in their neck and they start to do this every time they talk. Or you see that vein in their brain as they're trying to, stop the blood or contract or constrict the blood in their carotid arteries in order to lie. It's uncomfortable. Or you see they grit their gut. These are all lies. These are all forms of lie detection, I should say, and lies. So through clarity, that's what we do. We root through the lie. Now we then assess, after we rooted through those lies, that information we have. What did we find out? We found out that, yes, when you were a little girl, you were beaten, excessively. And you were probably molested there too, because you made 18 references to it, but you never said I was molested once. But you referred to somebody digging down your pants. You referred to somebody, making sure you were naked all the time so they can give you a bath when it was very inappropriate for you to do that. And then truth. We find clarity, we assess it, and then we take that and we try to determine truth. What is true? Not what I see in you that is true. What have your eureka moment have developed for you as what truth should actually be for you? How can we help you strengthen that? How can we help you build on that? How do we construct in your life an operation where in all things you do, you use the tenets of Arrow as well as the lessons you're being taught during your norm therapy sessions or interviews? How do we get you to bring that matrix and superimpose it over your life from now on? So you'll make those better decisions and not put you in those circumstances where you are being abused, or even take it once you understand that you are being abused. Those are the 3 tenets of our CAT: clarity, assessment, and truth.
Thank you for that explanation. And you talked about norm therapist, or NTIS, and we'll get into, in our next segment, we'll get into NTIS training. But right now, one last question, on goarrow.org, on the intake process, what does that describe, or can you describe how that works?
The norm therapy intake specialist is kind of different from the norm therapist, only in one area right now, is that bringing people into a nonprofit environment to serve them with the norm therapy product set, if you will, is one thing, because we're doing it from a point of view of not just being indigent, because oftentimes people who are abused, who are at our doorsteps, are looking for our support, not always have the wherewithal to find this kind of service. And to be very frank about that, this kind of service really just does not exist worldwide. When I say that, I want to qualify. Only 14% of the people in the world even have access to good mental health service. Only 14%. So what happens to the other 86% of people in the world? And let's look at that. That's mental health. Abuse care is what we do, but oftentimes people are referred to mental health for their support. So it's really almost non-existent abuse care. As we define the industry, which we're doing now, Kelly and I, from the inception, we looked at it and we were surprised that we could just about get any URL we wanted. We wanted abuse care, we looked it up, we own it. We wanted abuse foundation, we owned it. We wanted abuse abuse children, we own it. We own all of these kinds of URLs and some variations, and I'm speaking off the top of my head, but we own most of them. And we were surprised. Abuse Care Foundation, we own. How is that possible? Because people oftentimes refer people to mental health. So in building out norm therapy intake specialists, we had to define a role for the people who help people with no cost, or very little cost to us, but no cost to them. And that specialist, because we're not licensed therapists, we're not. We're commonsensical people with a lot of knowledge about looking out for lies. We're helping you root yourself through lies, and we're relatable. That's what we are. But at some point in the future, there is a possibility we'll be orienting all of our efforts towards being licensed. So we're never taking that off the table. Probably, I should say, it's squarely on the table. But as I move on, the intake specialist is different from the norm therapist. The intake specialist has to do with the nonprofit arena. The norm therapist, who will be operating from the for-profit side of things, totally separate from the nonprofit side, will be operating as norm therapists. And the norm therapy-oriented structure there has to do specifically with developing practices for the norm therapist, developing a marketplace for our service and wares. Instead of looking for grants and philanthropic gestures of support, we're looking for contracts. We're looking for government contracts. We're looking for business risk mitigation and risk assessment to corporations. Remember, a happy organization and a productive organization basically has to do with how well the people are doing. And if they're being bullied by their bosses, if they're being intimidated, if they're being overlooked and disregarded or abused in any kind of way at the workplace, not only will that hurt them in the workplace and will hurt any employer's bottom line, from government to corporations, it doesn't matter, worldwide, they all operate the same on the premise of money. And so if that's the case, we have to help with the bottom line by reducing the risk of any kind of abuse in the workplace for anyone. And most often women are the group on the planet that are most often abused. So we have to look at that from that perspective. Also, we have what we call on the for-profit side, something that doesn't necessarily exist on the nonprofit side, although it is still have the same benefit and it still have the same effect. But that is, we have what we call transferable assets. That means in a corporate environment, we go in and help you mitigate that risk of abuse in your organization, curtail it in most areas of your company, train your cadre of professionals that already work with your organization. They're already employees of yours. We train them to be a part of your EEOC programs and other equal rights programs within your organization, so they can help people to create an environment where they can police themselves and people can police each other. And that transferable asset, once people know how to deal with the stress of abuse or the abuse itself, they can then take that home and transfer that asset home. But they now talk to people differently. Our overwhelmingly response and plus that we receive from any of our cohorts or our classes is that when they leave norm therapy, forever they look at things differently. They look at people differently. They look at folks lying to them. They're looking at people, how they hurt them, how they will not allow that to occur. There are many other ancillary benefits that occur as a result of having been trained or receiving our norm therapy care. So we're on to something. But that's the difference between the intake specialist, which is on the nonprofit side, and the norm therapist that's on the for-profit side.
Great information. Thank you for telling us more about norm therapy and also diving into those three tenets: clarity, assessment, and truth, and talking a little bit about the differences between NTIS and norm therapists. So we'll wrap up today. We'll come back for our next segment and we'll dive into what is NTIS training. Thank you. Thank you, Michael.
Thank you.